Let's talk about health, baby. Let's talk about you and me. Let's talk about all the good things and the bad things that we see. Let's talk about health. Let's talk about health. Uh, let's talk about health. Let's talk about health. Welcome, everybody. So good to see you here in the chat this morning. And it's so good to see everyone here today. Good afternoon. You are listening to the JB Show on Revolutionary Blackout Network. I am your host, James Fauntleroy, and I'd like to give you all a warm welcome. This is to remind you that the JB Show streams every single Sunday at 1 p.m. Eastern Standard Time on Revolutionary Blackout Network, and you can catch me as well on the roundtable at 6 p.m. Eastern Standard Time on RBN. I also host my own channel called the JB Font Channel that I stream during the week on Tuesdays at 2 p.m. Eastern Standard Time. Now, please make sure to click the thumbs up, as well as please do not forget to click the bell icon, because guess what? You know it. The algorithm don't like us. So, everybody, good to see you today. Nice to see everybody here in the chat. Of course, the subject is going to be healthcare. Emily, yes, it is so good to see you in here today, and we're going to be discussing your favorite topic. And it's so good that you're going to be in here. And any type of little tidbits of information, please make sure anybody to also include this in the chat as well, because this is an interactive program. We actually like to have conversations with the audience. So if you have anything that you would like to add, or even any anecdotal evidence, please make sure to put that in as well. This is actually going to be a very good subject. I know a little bit about being in the healthcare system, so I can add some of my anecdotal evidence as well, and stories. And if you guys like to do that as well. Alex M, good to see you. Of course, not everybody's favorite topic, of course, but you say that it will never become a reality until capitalism is dead, related related by an egalitarian society. I do share some of the same sentiments as you, and I would love to see a truly egalitarian society where we actually have true healthcare for all. Um, and so it would be nice to see it replaced, as you so eloquently said. Thank you very much for that. CJ Howard says other countries have implemented socialized medicine without replacing capitalism. It is one of my favorite topics too, because it can actually happen given the correct amount of political will. You are speaking to an anti-capitalist, so therefore even though they're able to implement it, I would love to see capitalism gone, period. End of story. I don't want it to be something that actually helps capitalism to stick around for a while, but we do need people to survive instead of being killed by not having healthcare in this system at all. Eric Gray, good to see you. Hey, everybody. Gary, good to see you as well. Healthcare, are you kidding? It takes trillions of dollars to keep that stiff in the White House breathing. Yeah. Well, look, I don't know. I kind of think that he, sniffs children's hair, and then that keeps them alive a little bit, so you never know. But yeah, I mean, for the rest of us, healthcare is absolutely necessary. Terry Connolly, good to see you as well. Bill Bradley, good to see you again. Nice to see you on the other side. Lot 7X, hello, good to see you. Cryosynth as well, good to see you. Quaker Anarchist, my buddy, my friend. Hello, taking a break between tweet storming on Medicare for All and tagging Bernie Sanders. We tweet if you see any. This actually is a little bit of the inspiration for today's show, by the way, just to let you know. So, Quaker Analyst, Quaker Analyst. Oh my God, Anarchist. Well, you do analyze. I do have to say that, but Quaker Anarchist, thank you so much for putting that in there, as well as Sharif Shrugs. also for inspiring this show today as well. I want to thank you guys for doing this tweet storm as well. Uncle Warren, good to see you as well in the chat. Nice to have you here. Franken Kitten, good to see you as well. Bill Bradley says most Americans don't vote. Electoral politics in the United States is dead. Even if a lot of people don't want to admit it, politics will not lead to our answers. Strikes will. Thank you very much. Brady Weaver, so good to see you in the chat as well. Emily says, I am disabled with 40,000 plus in medical debt. That's why I can't stop talking about it. That is true. A lot of us have medical debt. I'll explain what I did today that is probably going to involve medical debt. So I'll be talking about that as well. Eagle Hawk Condor says, peace, everyone. Peace back to you, Eagle Hawk Condor. Welcome to the chat. It is so good to see you as well. Am I your favorite gay black man? It is so good to be favored by people, and thank you so much, Harry. It's so good to see you as well. Cape Socialist, welcome, and hey to you as well. So, we're going to be talking about healthcare today. So, what is some of the things that we're going to be talking about? Well, I'm just going to let you guys know. I put out a tweet a few days ago about my thumb, right? So as you guys can see, my thumb is doing a little bit better. It has a little bit of darkness right here, but other than that, that's about it. Try not to bite your nails, people, because then you can actually get an infection, and that infection's going to start to grow an abscess, and then next thing you know, it hurts like hell. And that wasn't fun. And so, you know what I did? I was like, you know what? I think I need to, everybody was like, yeah, JB, you need to get that checked out. Go get it checked out. And I was like, okay, so I think I should probably go to the urgent care because I don't want to wait for hours in the hospital because they're going to put you in triage. And then that triage basically means they're going to make you wait quite a long time. So I was like, you know what? There's a urgent care that's right near me. So I'm going to go there instead. And so I've been talking to some people and they were like, well, it's not that huge of a deal. If you can treat it yourself, you probably can treat it yourself. Just make sure that everything is sterile when you do it. And I was like, you know what? I do not feel like getting a bill in the mail. So let me just take care of it myself. So what I do, I did it. I popped the abscess myself. And even though it hurt like hell, I squeezed the discharge out myself. I know this is too much in TMI. It's whatever, but I'm sorry. But just to let you guys know, I did treat it myself. And I did everything that basically people were recommending me to do, even including the health professionals at my dialysis center. I asked them, as well for tips on what to do. So once I did that, the pain drastically dropped. The swelling started to go down. Everything was going pretty well. But because of a concerned family member, they were saying, still think you should go get it checked out. So I decided to go to urgent care this morning. I went to urgent care. I went in, and as soon as I came in, there was one guy that was in front of me, but I guess he was going to be seen by somebody else. The nurse goes, you're here to see a doctor? Yeah, come on. Didn't ask me my name, didn't ask me nothing. And he's like, so what brings you in today? And I told him basically what was happening. And he was like, you're a dialysis patient and they didn't give you antibiotics at the dialysis center? And no, they didn't, because that's a whole nother story. But they took a look at it. Then the doctor came in. She said, actually, to be honest with you, you did all the right things. You soaked it in Epsom salt. You got rid of the discharge. You're putting antibiotic ointment on it. To be honest with you, there's nothing really left to do. Just keep soaking it and blah blah blah. That's all she did. She didn't even she barely touched it. She barely just looked at it. Next thing you know, she was like, okay. And then they finally did the patient registration. By the way, all this took was like 6-7 minutes tops. The patient registration took 15 to 20 minutes. And they were asking me my insurance information and all that other stuff. So my question is, for them to just look at it and tell me, "Oh, you did all the right things, just keep doing what you're doing." How much is that going to cost me? That's my question that I did this morning because I was just trying to take precautions. How much is that going to cost? Basically, I got a diagnostic. That's basically all I did. Oh, the healthcare system here in the United States. You gotta love it, right? So, Quaker says, glad for a comment's first day today with their new kidney. Oh, congratulations. Congratulations to them. I need to get a new kidney actually, but that's a whole another story. Harry says, if we're going to talk about healthcare today, JB, we might as well talk about Medicare for all as a policy and how it will work. I am a policy geek. Hi, we're cut from the same cloth. Isn't it nice? Okay. So, yes, the more you know. Um, Christopher says, Super Bowl halftime star Dr. Dre severely beat a woman named Dee Barnes in 1991. Her stage name was, I forgot her stage name, but she has a really high pitched voice. But when she sings, her voice goes deeper because she has a larynx type of condition. Um, but yes, she has been interviewed and she was beaten by Dr. Dre. So yes, Dr. Dre is a woman beater, by the way. So yeah. I hate to ruin people, because that may be one of your favorite artists, but he did. Yeah. Michelet. Michelet. Yeah, that's her name. He used to beat her. Um so yeah. I'm not gonna be watching Super Bowl anyway, so it's whatever. Dr. Dre also is proud of beating a girl he named his headphone brand after the incident. Beats. Mm. That's a whole nother different story, but thanks for letting me know that. Uh, yeah. Yeah, he says, I used to bite my nails a lot in traumatic memory of getting infected an ingrown nail. Yeah, yeah. So that's why. And you know what's funny? I don't really bite my nails that much anymore. It's just that one time I did, and the next thing you know, poof, it just happened. I also hope we discuss the horrid stereotypes placed on folks whom you can tell cannot afford dental care. Shit lives do this and wonder why they're called out of touch. Yes, to those people who are embarrassed by their smile, are embarrassed by their teeth. I've had family members who went through that. Part of the problem is that we separate our health care from our oral care and our vision care from our health care and our mental care from our health care. It's all encompassing, but yet we still split it. Make that make sense. Did you know that if you have an infection in your mouth, that also can infect that can also lead to your heart having issues? So if it's connected, then therefore and it's all part of the body, then it should all be healthcare. Lord, these people, they make I'm tired. They just make me tired. They make me itch. These these motherfuckers make me itch. Thank you so much to Harsh Malarkey, I'm sorry. Anti-capitalist bleeds green, shaking my head. Bleeds green. I don't oh. Because money is green. Yeah. It was an infection. I can't, I can't, sorry. But hang on. Bluebird, good to see you. Even countries with socialized healthcare, capitalists put constant pressure to underfund, starve and privatize healthcare. It's called death by a thousand cuts, and this is what they do. So they will try to privatize even little portions of their national healthcare or the universal healthcare, just so that the insurance companies can come in and start making more money off of people in that country. So that's what it is. And so they basically kill it, incrementally over time. So that's what they do. And that's what they're trying to do with the National Health Service, the NHS in the UK. And so it's horrible. It's tragic what they're trying to do. And there's a lot of people on the left in the UK that are trying to strengthen it, trying to keep it from, going to shit basically in their country, because they see what we go through here and they don't want the same thing. So is there any chance that Nikki Cruz, Chocolate Thunder, crashes your show today? No, I don't think so. I don't think he's gonna crash. I mean, if he wanted to, he could, but we're gonna be talking about healthcare today, and he's a fairly healthy guy. But he did experience his grandmother passing away, and she was choosing between healthcare and thriving, and that's unfortunately an anecdotal story that he can tell. I wish that he didn't have that story to tell, because he lost his grandmother basically because of choosing whether or not to get health care or have to pay an exorbitant amount of money just to take care of herself. And, my heart goes out to him, because nobody should ever have to go through that. And to watch your grandparent have to do that, it's just heartbreaking. But I definitely, I wouldn't mind having him in here today to, have a conversation too. But I'm pretty sure it's also still pretty fresh in his mind. So let him chill for the day. Um, so um, I'm gonna show you guys one of the reasons why I also wanted to do this stream today. I'm gonna share my screen really quick. Um, where is it? Oh, yeah. Here we go. So it's everybody's favorite handsy Uncle Joseph, right? I'm gonna show you guys this video in a second. But the president said, "This is Joshua. He's 12 years old and living with type 1 diabetes. Like countless other Americans, his family has to pay thousands of dollars a year for insulin. It's unacceptable." Uh, Pretentious bastard. With my Build Back with my Build Back Better agenda, we can cap copays at $35 for this life-saving drug. I'm gonna respond to that in a minute, but let's just, God damn it, let's just play the video. God, let me mute my mic.
Joshua and Shannon, who are going to be introducing you today.
Well, good to see you, Joshua.
Good to see
How
you.
are you, man?
I'm good. I was diagnosed with type 1 diabetes at 11 months old. So my entire life, this is all I have ever known. And until there is a cure, all I will know. I'm thankful that insulin was invented because it is my life support. I don't have a choice whether or not to use it. I'm thankful that my parents do what they can to make sure I have insulin. Thank you so much to Congresswoman Spanberger and President Biden for all they're doing to make sure I will be able to continue to live safely and actively with affordable insulin.
Lowering the cost of prescription drugs is important, and this is about whether or not you and your loved ones can afford the health care you need and the medicines you need to stay healthy. I've long said health care should be a right, not a privilege in this country. Diabetes, Alzheimer's, cancer, they're not partisan issues. They're not Democrat or Republican. There's so much we can do.
Okay, never mind that they're using a kid to try to make some sob story about making affordable healthcare. Okay. When people say affordable, even a kid said it. He doesn't know better. He's like 11, 12 years old. The question always needs to come up. Affordable for whom? Affordable for whom? Look, let me share this again. Because shit like this chaps my ass, let me tell you. All right. What did Joe say? Joe said, with my Build Back Better agenda, we will cap copays at $35 for this life-saving drug. What if you don't have $35? Affordable for whom? I ask again, affordable for whom? And then people will be like, oh, well, there's different government programs. Well, what if you fall within that gap where you can't get it at an affordable rate and you're too poor to afford it? You make too much to get it. See, this is the crazy part, that they try to do a lot of this BS at, what's it called? Means testing. Means testing doesn't do anybody any good. This is when universality comes into effect. And then even in the question is, why in the hell are insulin prices so high? By the way, Joe Biden doesn't give a shit. He doesn't. I'm gonna say something controversial. Well, to you guys, it's probably not gonna be controversial, but to some people, especially liberals, it's gonna be controversial. Joe Biden is willing to let people suffer the way he did when his son died, all because of the people who bribe him. His son died of cancer. He's willing to let other people feel the same pain that he felt when his son died, all because they control him and what he says and what he does in government. The health insurance lobbies, the big pharma lobbies, they all control him. And he's willing to let them control him, which means that he's willing to let people feel the pain of losing a child or a loved one from a debilitating or chronic disease that probably could be treated or even cured if we had a proper healthcare system. He does not care about you. He does not care about that little boy who suffers from type 1 diabetes. That little kid was a prop. And even if his parents are watching me right now, your son was used as a political prop. Because if he really cared about your son, if he really cared about Joshua, there would be universal health care right now in this country, and he wouldn't have to worry about his insulin. Because even the creator of insulin cared way more about your son than Joe Biden ever will. Anybody looking at history will know that the creator of insulin actually patented and charged for it. He sold the patent for $1 so that everybody will have insulin if they need it. The patent was sold for $1. So here's the crazy part. If the patent was sold for $1 so that everybody can have insulin, why in the hell are we selling vials of insulin for $350? It's greed. And why aren't people like Joe Biden going after them? Greed. It's greed. Capitalism and greed go hand in hand. They're like peanut butter and jelly. They're like Shaggy and Scooby. Let's go to the chat really quick before I go to some receipts. Let's see. There's a famous video of Joe announcing that he was for sale. I believe it. Come on, man. You know the thing. Doja831 says that's how hijacked these nefarious oligarchs' minds are by money. Thank you very much. Yeah, Henry. Biden does love the way they control him. Martin says the oligarchs and their minions can never have empathy and will never develop sympathy. Sulamoon says Biden only cares about using that kid. Terrence says the establishment ideology is this: a certain amount of suffering is justifiable to maintain the establishment's power. Yeah, it's true. We already suffer from the shit that happens in life, and yet it seems to be okay to let people suffer from the system, even though you can change the system so that people don't suffer from the system. People are always going to suffer in life. People are going to die. People are going to lose family members, things like that. And we know this. But why are you exacerbating the suffering by allowing the system to continue to perpetuate that suffering, even though we suffer enough as it is as imperfect human beings? Like, make that make sense. And yes, it is not just him among friends. It's also many of the people that surround him. It's psychopathic nature, and it's crazy. And yeah, you know what, LeBron, I'll concede to that. But the thing is that it's not just Homeland Security. It's the CIA. It's the bankers. It's the central bankers. It's all of them. Like, all of them. And yes, is he a puppet? Yeah, I'll concede to that. Definitely, he's a puppet. Joe Biden. So, let me see here. Here we go. People want to talk about, while we're on the subject of insulin, this is from rand.org. Average price per unit across all types of insulin in 2018, 3 years ago. United States was at $98.70. Basically, let's just round it up to $100. So $100 for insulin in 2018. In Japan, the next highest one was $14.40. How many of you would like to pay $14.40 for your insulin? This is the astronomical price of insulin hurts American families. No shit, Sherlock. People spending hundreds of dollars just for vials of life-saving insulin. I have a couple of diabetics in my family. I'm not diabetic, but I have a couple of diabetics in my family. You mean to tell me that they could potentially die because of not having enough money for insulin to take care of themselves? As we say in the Black community, you got me fucked up. Especially when the patent for insulin was sold for only $1. Nope. Nope. No. Mm-mm. No. No, sir. No, ma'am. Okay. People like Joe Biden is beholden to the health insurance industry. Health insurance industry has been making record profits. Record profits. This is from Live 5 News. It says health insurance companies make record profits as costs soar in the U.S.
¿No califica usted o no puede pagar los altos costos y
Oh,
los deducibles
God,
del
really?
seguro médico?
As inflation and pandemic hardships weigh on the wallets of Americans, healthcare costs keep climbing.
It doesn't cover 100% until we meet $12,000 out of pocket first.
For Jessica Jones and her family, that's devastating, with her son battling a chronic heart disease.
Making choices, are we going to pay this medical bill or are we going to keep the lights on? My husband and I had conversations about divorcing so that we could get Medicaid for our son.
According to the Kaiser Family Foundation, the price of an employer-sponsored family policy is up 47% since 2011, outpacing wages and inflation, meaning premiums and deductibles now eat up more of the average family's income, 11.6% as of 2020. A December poll found 46% of insured adults struggle to afford out-of-pocket costs, and 29% have not taken medicine as prescribed because it's too expensive.
They have health insurance, but they still can't afford to get the health care that they need.
Yet health insurance companies are making record profits.
So how many people have had to skimp on their much needed medication because they can't afford to get any more medication? It's a lot of people. And still, these people are making record profits. It's ridiculous on its head.
For United Health, the largest insurer in the U.S., net earnings have surged since 2015, reaching $17.7 billion last year, as their business has rapidly expanded into other healthcare sectors.
Not bringing down the cost of care, not giving people relief from premiums and out of pockets, but enriching their shareholders and their top executives.
The Affordable Care Act includes a rule that insurance companies must spend at least 80% of the money made from premiums on healthcare costs and improvements. The other 20% can go to administration, marketing, and profits. Last year, United Health returned more than $5 billion in dividends to shareholders, and other companies have done the same.
But if you want to talk about the drivers and why deductibles are up, health insurance company profits, they're a piece of it, but a pretty small piece of it.
It's part of a bigger debate about healthcare spending, which has soared in recent years. Prices set by providers like hospitals, doctors, and pharmaceutical companies are going up, even as fewer Americans have accessed medical services during the pandemic. Administrative costs alone make up more than a quarter of U.S. healthcare spending.
The for-profit companies are taking on an ever greater role within the U.S. healthcare system.
It's a complex issue, but for Jessica Jones, it's simple.
If the cost goes up, we could lose everything at this point.
And you wonder why people are becoming radicalized. For good reason. These companies are literally making bank off the backs, off the suffering of so many people. And people are like, well, why aren't the politicians doing anything about it? Well, I can show you that. Our favorite site, opensecrets.org. Insurance companies. Let me enlarge this so that I make sure that all y'all can see this. All right. Take a gander. Right? Blue Cross Blue Shield. A total of $1,187,165 spent in contributions between 2021 and 2022. Democrats got $422 in contributions. Republicans got $433,797 in contributions. Cigna, $229,000 for Democrats over that. And Republicans got $294,000 from Republicans. Apex Health is all Republican. And this is different types of insurance, by the way. These are life insurance, car insurance. Top lobbying clients. Blue Cross Blue Shield, $18,446,385. America's Health Insurance Plans, $11,290,000. Cigna, $9,140,000. AFLAC, American Prosperity Casualty Insurance Assistance, whatever it is, whatever the hell it is. So, top recipients: Charles E. Chucky Schumer got $342,000. Tim Scott got $248,000. Patrick McHenry, $183,000. Richie Neal, $182,000. Stephanie Murphy, in my state, got $181,000. These are the top 5, a mix of Democrat and Republicans. Guess what? It's all one big club, and they don't give a shit about you. It's all one big club. Like, look, that's who's getting it. You damn, know for sure that Joe Biden was definitely one of those big people who were donated to. So that's who contributes to the politicians. Prester John, thank you so much. FDA and CDC receive funding from the industries they regulate as well. Yep. And big pharma's no better. They're not any better at all. Like Fire Marshal Bill said, let me show you something. No, get out my face. Okay. Oh my God, really? Get out of my face, these stupid ass. Pfizer revenue and profits soar on its COVID vax jab business. God, I gotta censor my language just so that this thing doesn't get demonetized. Bunch of bullshit. So Pfizer reported earnings and sales more than doubled in the last quarter. Just in the last quarter. It raised its outlook for the results for the full year thanks to its C19 jab. The company reported adjusted earnings of $7.7 billion, up 133% from a year earlier. Revenue soared to $24.1 billion, up 134%. Both easily cleared results forecast by analysts. The jab business alone was responsible for more than 60% of company sales, as jabs revenue rose $14.6 billion from only $1.7 billion a year earlier. The company said its jab sales accounted for $13 billion of that revenue. Revenue outside of the C-jab business was up far more modest, 7%. So basically, pandemics are good business. For them, it's great business. This was the big catch. This was their diamond in the rough. This was the thing that they were waiting for. This is the gravy train. It's always about profit. That's all it is. People were like, well, we didn't pay out of pocket. And like, no, the government paid the money. It was federal spending. Funny part is, we can spend this much from these private companies, then imagine what we can do by producing it ourselves. Imagine how much it would cost for us to only produce it ourselves. We could probably do it just like Cuba did. Produce it ourselves for a lot cheaper and potentially safer. Okay. Let's get that out. Let's get this out. I did that already. They don't care about you. How do I know? Because of this. This is a graph. It says number of hospital beds in the United States from 1975 to 2019. 1975, we had a total of 1,465,828 hospital beds in the United States. It has dropped precipitously over the last 40 plus years. It's down to 919,559. And falling probably. But why, why in the hell did our hospital bed amounts drop in the country while our population was going up? Our population was rising. We're over 330 million people in this country right now. In 1975, the population in the United States was 216 million. So we've gained over 100 million people, and yet our hospital beds have dropped. 100 million people, hospital beds dropped. Make that make sense. It's brainwashing at its highest order. I'm telling you. Yeah, Beverly Jensen. They try. It's like, oh well, we got to make things more scarce. Why? Because scarcity makes things more profitable. You can charge more money for something that's more scarce. It's just like when they used to give us the BS argument that, oh, well, diamonds are so expensive because they're just really that scarce. So you got to pay top dollar for them. What happened when De Beers found out that they had actually mountains and mountains of diamonds that it would drop the price of diamonds. They bought the diamond mine and only put out so many diamonds a year just to make it seem like that there's a scarcity in diamonds when really diamonds are extremely plentiful. Diamonds are not rare. So they're literally controlling the markets just so that you will pay more money for a rock. What makes you think they're not doing the same thing for hospital beds in the United States? They're doing the exact same thing. They're dropping the amount of hospital beds just so that it makes it more scarce, so that they can charge you more money, either through your insurance or by billing you. This is some bullshit at the highest order. And the crazy part is people are actually waking up to it. But the problem is that the politicians are so bought that they don't want to do anything about it. And so a lot of times people are like, so what is the answer? Some of us want to do some drastic things. I can't really say what those drastic things are on YouTube because, well, it's YouTube. But in the meantime, I want to give some attention to some comrades that I dearly care about, and they have been doing great work on the ground. My homie, Quaker analyst, she's tagging Bernie Sanders, and they're basically doing a large tweet campaign right now. And also, there's going to be a Bernie Broke My Heart rally on Monday, tomorrow, for Valentine's Day. To basically talk about healthcare, because it seems to have been forgotten by the people who pushed single payer healthcare. It's like, so what's up? Like, why aren't you guys fighting in that battle? Why aren't you using the bully pulpit that you have now to force the hand of people like President Biden? Because it's obvious that you guys aren't on the same side. Because this is the same guy on Lawrence O'Donnell that said that he would veto Medicare for all if it passed both the House and the Senate. So why in the hell aren't you trying to use your popularity, by the way, as the most popular senator in the country, to push Joe Biden into doing this, into giving us health care? Mind you, in Section 1881A of the Social Security Act, Joe Biden could give every single American health care if in case of an emergency. By the way, we're in the middle of a pandemic. It is an emergency. And yet, here we are, dying day in and day out because we just do not have health care. At least a third of the people who died because of this pandemic could have been saved. And yet they don't want to do it. They'd rather you just die on the altar of capitalism and say, get back to normal. They don't care about us. Fortunately, people like Sharif and Quaker, anarchists, do care, and they're leading the charge in this way. So I do, recommend anybody who's on Twitter, to at least shame the politicians, including Bernie, in a public way, because it's something. It's something. But what these politicians are doing, they're not doing a damn thing. Jen said we go from Dem to Republican to Dem, from Dem to Republican, and nothing changes. The rich get richer, we work harder for less, military budget grows while they say no money for us. Yep. So the hospital beds have went down. Profits from insurance companies and pharmaceutical companies have went up. President Hair Sniffer decides to put a 12-year-old boy as a political prop to make it look like he's actually going to do something when he's not. Any wonder why people are sick and tired of being sick and tired? Money Making Bear says, what would the oligarchs do to Biden if he gave us health care via executive order in a pandemic? We must organize and make him do it. To be honest with you, the threat from the people has to be greater than the threat from the oligarchs. I know, I said it. But the threat from the people has to be greater than the threat from the oligarchs. You got to make them more scared of us than of them rich bricks. It's funny because single payer healthcare is actually pretty popular. And yet, doesn't get passed, doesn't get talked about because it's not, especially last year because it was because it was an election year. So yeah. I know about healthcare. I'm on kidney dialysis. I've been on kidney dialysis for almost 15 years. So I know about the healthcare system. Oops. And so because of what I've been through, I see it as a dire need. And I don't want anybody else to have to go through what I went through. You got people literally in other countries going, you have to pay to have a kid. Welcome to America. I remember I received an $8,000 bill from a dialysis company because apparently my Medicare ran out because I couldn't pay the premium. And because I didn't pay the premium, my Medicare ran out, and the dialysis center was like, "Okay, well, we're sending you a bill. It's for $8,000. By the way, I only received 2 treatments, and they charged me $8,000 for a life-sustaining treatment." So that's what happened to me. And yeah, $2,100 for a 5-mile ambulance ride. Better off getting an Uber. John says, I dropped my health care this year. I trust no doctor, especially after this COVID fiasco. Yeah. Yeah. I remember having people come into my hospital room and asking me if I had a credit card so that I can have a procedure done. I'm sorry, what? The woman that walked out of the hospital while in labor? What? What happened? I didn't know about that. That's wild. Don't tell me it was because she walked out while going into labor because she couldn't afford to have a baby in the hospital. Because if that's the case, that's just sick. Oh my gosh. That's the question. That's the question that's always asked. US, what is the value of each person? Basically, what is your economic value? There's this sentiment that is across the United States that basically you're worth more by how much economic value you have. So if somebody super rich dies, it's a huge deal. But if somebody who's very poor dies, whatever. Not realizing that everybody has the same amount of economic value. I'm sorry, the same amount of human value. Their economic value does not matter because everybody's life matters. Dystopian life in Southern California. So yeah, let's be real. Um, People don't realize that in other countries, we are the only developed country in the world that doesn't give its citizens health care. The crazy part is we can afford it. People will be like, well, how are you going to pay for it? How do we pay for the military budget every year? We just, what do you think we do? We just squeeze our eyes closed really easy and just wish and wish and wish and wish. Oh, I wish to have the military budget at $760 billion. I wish, cross my fingers, cross my heart, hope to die, stick a needle in my eye. If you know about MMT, you'll realize that it's just as easy as beep, 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 enter, and that's it. And suddenly we have enough money to bomb brown people in other countries. But we can't use that same money to save lives in our own country. Yeah. Yeah, true. How are we going to pay for it now? It costs more now than if we had single payer. It does cost more now. We're paying through the nose because these corporations, these leeches, are basically trying to take more out financially. It's crazy, man. Wait, there was a quote. Sula Moon says there's no profit in saving lives, only taking them. Yep, that's true. And then they always talk about, well, that's just the nature of the beast. You have to, make money somehow. And it's like, yeah, but not like that. Not by forcing people into a position where they either have to, starve or die or get health care. You can literally have both. We can actually have nice things in this country. So yeah, I'm gonna be honest with you. Being somebody that is chronically ill, that has went through, what we've experienced in this country, that's crazy. Just a question to everybody. What was the longest you ever spent in the ER? What was the how many hours? Yeah, that's true. How many hours is the most you've ever spent in the ER? For me, it was 9 hours I spent in the ER. That was the longest time I've ever spent. $2 days? They sat you in the ER for 2 whole days? What? Oh my God. That's crazy. As in 40, like where a program said, as in 48 hours waiting in the ER? Because look, I have the most I did was 9 hours. Wait, well, hold on. Was it 9 or was it? I've been in the ER in the back in a bed, I think upwards of like 15 hours, but yeah, before they, move further and actually got anything done, yeah, I spent that much time. My point is that, and me asking that question, imagine if people could have preventative health care. Imagine the backlog of how long you have to wait in the ER is drastically reduced, so you don't have to wait as long. So that going to the ER won't be such a huge ordeal, because the people who really there at the ER are there for an emergency. And whatever you may be dealing with medically, you could have gotten done at a doctor's office or a clinic because you didn't have to worry about cost of healthcare. And you could just go, get it done, and go home. And this is part of what I'm getting at. A lot of times, a lot of people who may be new to this network or new to watching me will say, "Yeah, we need single payer healthcare." I say, uh, "No, single payer healthcare is not good enough. Not good enough for me. I actually want a full nationalization of the entire thing. Medical device manufacturers, pharmaceutical companies, the health insurance companies, the hospitals, the clinics, all of it. I want it all nationalized. Nationalize it all. The reason why I say nationalize it all, because uh, every single avenue, they're going to try to use profits over people, and then next thing you know, somebody is up losing out either in their life or become more sicker because they don't want to, because it has to be driven by profit. So this is one of the reasons why I'm further left than a lot of people, because I'm just like, you know what? No, nationalize it. If we had a national health system similar to the UK or similar to what Cuba has, there wouldn't really be that big of a need for mandates, because there would actually be a lot more trust. Because if it's ran by the people, then yeah, wouldn't be that big of an issue, because Cuba don't have mandates, and their jab rate is over 90%. And yes, dead people's things. Medicare for all is the compromise, or as like I say, was the compromise. My price just went up. Yeah, my price went up. Yeah, I don't want Medicare for all now. I want a national healthcare system in the United States. You want to call it AmeriHealth or something like that? I don't care. But we're nationalizing it all. That's what I want now. Medicare for all is not good enough anymore. I don't care. Like, the hell with it. And yes, the only reason people are afraid is that brainwashing, because people are like, oh my God, socialism. Guess what? It's funny because the socialists are actually having better healthcare outcomes than we are. Oh my God, socialism. So yeah. I'm pretty much done with this system. I like, I'm sick and tired. Look, I'm sick and tired of people being sick and tired. Yes, I also agree with that, but that's a completely different conversation that we'll have another day. But yes, I agree. And yes, Quaker, um, our NHS comrades remind us that NHS needs to be, one, protected from immediate destruction, and two, much needed expansion. Yes. I would actually like to have our own NHS, but at the same time, we also have to continuously fight to keep it alive. Zach Davis says, I'm disabled and I make $20 a day. They won't let me work without taking my Medicaid. I'm ready to match some stuff up. We need a change. Yeah. Because just to let everybody know, for those of us that are on Medicare, like I have Medicare. So Medicare only pays 80% of your healthcare costs. So let's say, for instance, I got a $10,000 medical bill. Well, I'm on the hook for $2,000. I don't have $2,000. So what do I have to do? Well, I have to get a second insurance because I'm so poor. So I have to get Medicaid. And Medicaid can pick up the other 20% if my income is low enough. But if you fall within that gap of you make too much to have Medicaid, but you're too poor to be able to afford that $2,000 left over, guess what? Now you have to worry about being on the hook for that 2,000, and then the next 2,000, and then the next 2,000, and then the next 2,000. Not to mention the co-pays, deductibles, and premiums that come with these things as well. And long-term care, Quaker, and long-term care, especially for those of us who are older. Yes, definitely. And while we're at it, Social Security disability, why isn't Social Security disability paying a living income? We're expected to get some, Social Security disability, and yet they expect us to live in poverty. What sense does that make? I like that. We have to be one that knocks and not the one that begs. Absolutely. And the thing is that it reminds me of the phrase. Oh my gosh, I'm forgetting people's names. I should have ate breakfast this morning. I haven't eaten yet. Um, Hang on. Frederick Douglass. Let's go. Let's go to it. Just so that people. Yeah, that's crazy. You should get like way more than that. Hang on. Let me show the quote because I read this at the Medicare for All March. And I read this part. I'm gonna read the entire thing. Frederick Douglass said, "This struggle may be a moral one, or it may be a physical one, and it may be both moral and physical, but it must be a struggle. Power concedes nothing without a demand. It never did, and it never will. Find out just what any people will quietly submit to, and you have found out the exact measure of injustice and wrong which will be imposed upon them. And these will continue till they are resisted with either words or blows or with both. The limits of tyrants are prescribed by the endurance of those whom they oppress. The light of these ideas, Negroes will be hunted in the North and South and held and flogged in the South so as long as they submit to the devilish outrages and they make no resistance, either moral or physical. Men may not get all they pay for in this world, but they must certainly pay for all they get. If we ever get free from the oppositions and wrongs heaped upon us, we must pay for their removal. We must do this by labor, by suffering, by sacrifice, and if need be, by our lives and the lives of others." Power concedes nothing without a demand. So I'm not going to take too long. I'm going to end up cutting this JB show short because my brother's exhausted. I'm tired. And I just wanted to talk about healthcare today because it's deeply important. If you guys are on Twitter, make sure to follow Quaker Anarchist and Sharif. And you know, either retweet or participate in the tweet campaign. At least get something going, you know, so that people can start talking about healthcare more because it's deeply important in the middle of a pandemic. So, yeah. But I hope you all are having a good day. A lot of people are going to be watching the big game tonight. If you are, it's whatever, you know, do you. I probably won't be watching it because I'm going to be doing a show later with somebody. Hang on, I gotta get their name again because I want to make sure that I say it correctly. Hold on. JB. Okay. I'll be on the Rochford Files. It's gonna be tonight. At 8 p.m. So be sure to go there. Let me get it up on the YouTube, the tube. Hang on. Let me see. Switch this account. Okay. No, it's not. I can't spell today for some reason. Hang on. Why don't I just go to... Okay. Got it. Okay. I'm going to put the link in the chat. And I'll be on this channel at 8 p.m. tonight. So you guys can be there if you're not busy watching The Bowl. OTR Trucker says 8 hours when I had a pancreatitis. They did an ultrasound and an MRI trying to confirm it. You know what's funny? And this is before I go. I've been listening to people, especially on TikTok, talk about their experience being an American outside the United States. And a lot of times they'll go in for like an ultrasound or they'll go in for an MRI or an X-ray or something like that. And they'll go in. It'll be like in Spain or it'll be in France or something like that. And they'll go in, wait like 5 minutes, and then they'll go get the, let's say, the X-ray, and then 5 to 10 minutes later, they walk down the hall, boom, it's ready for them. The results are there. And here in the United States, they make us wait hours and hours and hours just to get results for something that doesn't really take that long to show. Like, what? Are you kidding me? So it's crazy. And people want to talk about, oh, well, you guys have to wait in long lines in these socialized, you know, these countries with socialized medicine. It's like, what the hell do you think we're doing here? Like, we're seriously waiting for hours upon hours, and somehow the United States is better? Give me a break. Anyways, I'm going to be on there tonight, and be sure to watch my channel this Tuesday. This Tuesday on the JB Font channel, I am going to be having Comrade Misty on, and we're going to have a discussion about press freedom. So be sure to watch that. Also, just to let everybody know, if you guys are into our content and like what we're doing here, then you can always subscribe to our Patreon. That's patreon.com/Rev Blackout Network. And what else? Do I have anything else? Water. Drink plenty of water. Drink plenty of water. And I know it's a game day for some people, but when they bring the carrot sticks and the celery sticks along with the wings, get down on some of them carrot sticks and celery sticks. They're good. And also, if you don't have a nut allergy, some almond butter, some peanut butter, do the damn thing. Bye, I guess. I'm so stupid. Make the world better. Leave the world better than you found it. I wish you love, peace, and coconut oil grease. I'm trying to be more healthier. Anyway, smoke them if you got them. Okay, bye. Why are you still watching? Go home. It's over. Golly. I love you. Forehead kisses. Mwah.